Hello, thank you for visiting Children's Emergency at KK Women's and Children's Hospital. Your child has had a cut, which your doctor has assessed to require stitches or sutures. We have put together this video to help you understand more about how to care for your child's wound after it has been sutured. In this video, we'll talk about suture types, how to look after the sutured wound at home, when you should come back for any follow-up appointments, and when you should seek medical attention. In general, there are two suture types, absorbable and non-absorbable sutures. Absorbable sutures will usually fall off about 7 to 10 days as the wound begins to heal. There is no need to visit a doctor or to use any instruments to remove them. Non-absorbable sutures will require a follow-up appointment to remove them. Depending on the wound site and characteristics, your doctor will use absorbable, non-absorbable, or even a combination of both suture types. Your child's cut will be red, tender, and swollen straight after suturing. These symptoms should clear as the wound starts to heal after about 2 to 3 days. All wounds, whether stitched or glued, will leave a scar. Initially, the scar may be red or purple in color and will fade to light pink, white, or nearly invisible over time. This can take up to a year. There are 3 aspects to looking after your child's wound at home: general wound care, wound cleaning, as well as administering medications. At home, be sure to keep the wound clean and dry. This will allow the skin to come together and start the healing process. To reduce facial swelling, you may elevate your child's head with 2 pillows at about 30 degrees. Ensure your child does not rub, scratch, or pick at the wound. Any scabs that form will come away on their own once the wound has completely healed. Avoid swimming for at least 3 to 4 weeks after the injury. Avoid exposing the wound to direct sunlight. Once the wound is healed, you may use sunscreen over the healed wound for at least 12 months to prevent the scar from darkening. Clean the wound 3 times a day and whenever there is oozing of blood or discharge. When cleaning the wound, prepare cooled boiled water, saline or sterile water. Clean cotton buds, as well as the prescribed antibiotic ointment. Remember to wash your hands before and after cleaning the wound. There are 3 steps to cleaning your child's wound. First, clean in between the sutures by sweeping across the wound using the wet cotton bud. Ensure that all the ointment from the previous application is removed. Then, clean the stitches themselves by rolling the wet cotton bud downwards, following the direction of the suture line. Finally, apply a thin layer of the prescribed antibiotic ointment onto the suture line by rolling the dry cotton bud downwards. Remember that applying too much of the ointment may delay wound healing. Your child may need some simple pain relief, such as paracetamol, in the first couple of days following an injury. Your doctor may also prescribe antibiotics to prevent infection of the wound. Complete the course of oral antibiotics as prescribed. Your child may require a follow-up appointment with one of our specialists at the hospital to review the wound and remove sutures. Your attending doctor will advise on the timing of this appointment. In general, appointments will be scheduled within 7 to 10 days for sutured wounds on the face and 10 to 14 days for sutured wounds on the trunk. To reschedule your appointment, kindly contact our central appointments office. You should seek medical attention if you notice the following: if your child develops a fever of 38 degrees or higher, if your child's wound splits or gapes open, if there is excessive discharge or bleeding from the wound, if the wound becomes increasingly red, swollen, or feels warm to touch, if your child has severe pain not relieved by the prescribed pain medications, or if your child has any abnormal or prolonged symptoms which cause you concern. During office hours, you may contact the appropriate follow-up clinic. After office hours, kindly return to the Children's Emergency for any urgent consults, especially those pertaining to suspected wound breakdowns, infection, or bleeding. You may also choose to use our Urgent Pediatric Advice Line, or UPAL. This is an online service for caregivers and parents to seek advice on common pediatric conditions and injuries. UPAL is available 24 hours daily at no charge. Key points to remember are: your child's cut will be red, tender and swollen straight after suturing. It should improve as the wound starts to heal after about 2 to 3 days. Remember to clean the wound 3 times a day and apply the prescribed antibiotic ointment in a thin layer. In between cleanings, keep the wound clean and dry. Bring your child to a doctor if you notice your child having any of the warning signs explained earlier. We hope you feel more confident in looking after your child's wound after watching this video. Do also refer to the pamphlet given for further details.